I'm Judy Shaw for NYC Floor Talk. Joining me today is Dr. Robin Berzin. She is founder and CEO at Parsley Health. Robin, it is wonderful to have you here. Thanks for joining me today.
Thanks for having me. I'm thrilled to be here.
My pleasure, my pleasure. So now, Robin, Parsley Health is a digital health company that helps men and women reduce the cost of chronic conditions. You just put out a report called The State of Health of Women in the Workforce. Tell me, why did you do a report just on women?
As you said, Parsley Health's care works equally well for men and women. And when you look at the 60% of American adults who have a chronic condition, these conditions impact men and women alike. But in the workforce, when you look at the data, women are disproportionately impacted. And in fact, women spend $85 billion a year more than their male counterparts on healthcare, and only a fraction of that is due to pregnancy. And so if you want to look at having the impact and the cost savings that we're all looking to see in healthcare, we believed you had to start with women.
All right, so tell me, what did you find?
We commissioned a survey of 1,200 working women to understand how do they experience their health and what's working and what's not. And the results were really astounding. First of all, women are sick. 50% have missed a day of work in the past 60 days for a health reason. Second, they don't know why they're sick. 2/3 of them said that they have symptoms that they don't have a real diagnosis for. And the third thing is that they're giving up. 80% said that they are delaying care, meaning not going to the doctor when they feel sick or when there's a health problem. Number one, because of time poverty, they don't have time to go to the doctor. Number two, because of cost. Number three, because they said that they feel dismissed or unheard in a healthcare setting. And number four, because in their words, they're tired of just being prescribed another pill. This situation is a huge problem for employers when we think about absenteeism, when we think about trying to retain women in the workforce, and when we think about the skyrocketing cost of healthcare.
Okay, so what would addressing healthcare in a new way look like? And is that scalable?
The thing is, we can't keep doing the same thing and expecting changes, so it has to be scalable. And the good news is, when you look at the 90% of our healthcare costs that are due to chronic conditions, many of these conditions, most of these conditions can be improved or even reversed with root cause medicine. That means putting nutrition, mental health, sleep, fitness onto the prescription pad next to medications. It also means creating a home base for people to address more than one condition at once. We can't keep asking people to go to 5 different specialists for 5 different symptoms. It means meeting people where they are, which means telehealth, bringing medicine into our homes and our places of work. And it means making care affordable, the care that people really need, making it affordable. Parsley Health has been offering this kind of care, root cause medicine, for years, and we have independently validated data showing that our medicine reduces the chronic prescription drugs people are on, reduces specialists, reduces procedures, and reduces cost of care by 32%. So this makes this kind of medicine a value for employers, for health plans, and for patients.
Okay, all right. So now, Robin, tell me, what's next on the horizon for Parsley Health?
Today, we are working with some of the country's largest employers and health plans. We are in network for over 10 million people and growing. And we are on track for our first value-based contracts, which means that our major health plans are recognizing the value and the impact of root cause medicine and making this care accessible and affordable for patients to live healthier and longer.
All right. Well, Robin, it's been wonderful to talk with you. Thanks for joining me on Floor Talk today.
Thanks for having me.